Pipettes are used to measure precise volumes of solutions. In this video, I will demonstrate the volumetric pipette, how to care for the pipette, rinse the pipette, and use it to measure your calibrated volume. This is a volumetric pipette, as noted by the one single calibration line. That means that a volumetric pipette will measure one volume only, but if used properly, the pipette will measure that one volume to a high degree of precision. Volumetric pipettes come in different sizes. This is a 10 milliliter volumetric pipette, noted at the top of the pipette, and the tolerance for the pipette is noted at the top as plus or minus 0.02 milliliters. So I would record the volume of this pipette to 2 decimal places as 10.00 milliliters. When you're not using the pipette, please lay it on its side on the lab bench top such that it will not roll off the edge of the lab bench. Before measuring the calibrated volume, you need to rinse the inside of the pipette. You do so by drawing liquid up into the pipette. You need a pipette bulb. Squeeze all of the air out of the pipette bulb. Barely attach the pipette bulb to the top of the pipette. Submerge the tip into the solution to be measured. I'm using green dye. I'm allowing the tip to gently rest on the bottom of the beaker. Slowly and gently release your grip on the pipette bulb. That will allow liquid to come up into the pipette. Remove the pipette bulb and simultaneously tightly cover the top of the pipette with your finger. Tilt the pipette. Allow the liquid to move up in the pipette past the calibration line, but do not allow the liquid to come out the top. Rotate the pipette so that the liquid contacts all of the inside surfaces of the pipette. Tilt the pipette vertically, allow gravity to drain the liquid from the pipette. Touch the tip of the pipette to the clean inside surface of your receiving vessel, and you may notice that there is a little bit of liquid left in the top or in the tip of the pipette. This is correct. Your pipette is calibrated to keep that little bit of liquid in the pipette. We're going to rinse our pipette 3 times with the solution to be measured. To measure the calibrated volume of the pipette, again you need to draw liquid into the pipette. This time, allow the liquid to come above the calibration line. You may squeeze on the pipette bulb to keep the liquid from coming into the bulb. Replace the bulb with your finger. Be sure to lift the bulb straight up so you do not snap the top of the pipette. In order to correctly use the volumetric pipette, the meniscus must be at the calibration line. So you should draw the pipette up so the tip is out above the liquid. The pipette needs to be held vertically. You should be looking at the calibration line and at the meniscus at eye level. You need to release the suction of your finger so that the liquid level can come down so that the meniscus is at the calibration line. I achieve this by rotating the pipette so that my finger is loosely resting at the top, and I can squeeze my finger to apply suction when the meniscus is at the calibration line. If the meniscus goes below the calibration line, you have to start all over. Drain your calibrated volume into the clean and dry receiving vessel. Please avoid getting liquid into the pipette bulb. Liquid in the pipette bulb can contaminate your solution, and some liquids will corrode the inside of the bulb. You can avoid getting liquid into the bulb by squeezing down on the pipette bulb. That will force the liquid back down. You can control the flow of the liquid into the pipette by gently allowing the tip of the pipette to rest on the bottom of the beaker. That restricts the flow of the liquid so that it doesn't rise too fast and is difficult to control. The key is that the tip of the pipette must remain submerged in the liquid. If you have liquid in your pipette and you allow air to come in, then this liquid will squirt up into the pipette bulb. If you find that the liquid level in your small beaker is getting very low, you can tilt the beaker so that the pipette will remain submerged in the liquid. When you are finished using the pipette, you need to rinse it, please. We rinse the pipette with deionized water. Again, drawing liquid, the deionized water, up into the pipette as far as the bulge. Tilt the pipette, allowing the water to access and come in contact with the inside surfaces of the pipette, and let gravity drain the water out of the pipette. Please rinse your pipette 3 times with deionized